Today's topic is the utilization of shape memory alloys in the field of medicine. Actually, this is just a case study that I have been involved in. But shape memory alloys are not new in the medical field. I'm just trying to give you a perspective of what we're trying to do with these alloys, like a new problem, new solution. So. By the way, sorry about that, I forgot. My name is Demircan Canadinç, and I'm a faculty member with the Mechanical Engineering Department here at Koç University since September 2007. Okay, so let's get started with what are shape memory alloys. Well, shape memory alloys are metallic materials. We also have shape memory polymers, but I'm going to stick to metallic materials in this presentation. And these are materials that undergo phase transformation from solid to solid phase upon application of either loading or temperature or both of them. Now, when we talk about phase transformation, the first thing that you might think of is the solid to liquid to gas phase transformation, or the other way around. But the type of phase transformation that we're talking about today is the solid to solid phase transformation, which actually takes us down to the atomistic level regarding the material structure, such that these shape memory alloys have two different structures at two different temperatures. So, or in stress-free condition and the loaded condition. So, how does this occur? Let's talk about this a little bit to understand how we use these materials. Well, it's all about energy. So, at low temperature, the material has a certain amount of energy that it is stable with, and it likes to stay at that level of energy. Just like any other system in the universe, we like to satisfy the condition of minimum state of energy or the stable state of energy. If you end up increasing the temperature of these materials by providing external heat to these materials, then you end up with the high temperature phase, because the material cannot be stable at its low temperature structure anymore. So it has to somehow compensate for the additional energy provided from outside, and that method is undergoing solid to solid phase transformation. That is assuming a different structure at atomistic scale, which actually can be observed as a shape change of the material at the macroscopic level. There is another property of these materials, which is the so-called pseudo elasticity or super elasticity. It's not elastic, but it is like elasticity. And the thing is that when you apply stress, that is loading, to these materials, then again, due to the unstable energy level, the material changes its microstructure, and in the loaded case, it has a different shape. And when you release the load, that is when you actually end up, sorry about that, when you end up releasing the load, unloading the material, then what's going to happen is that you're going to go back to your original shape, and this is called the super elasticity. Due to these wonderful properties, these materials have been utilized in various industries, starting with the military industry, and then also especially aircrafts. They benefit from these materials, and civil aircrafts partially benefit from them. In medical field, they have been utilized for a while, and also structures that are resistant to earthquakes, they benefit from these materials. Now, let's talk about a little bit more details how this happens. Actually, we have three different properties. One of them is called the one-way shape memory effect. The other one is the two-way shape memory effect. And these are related to this type of temperature-induced phase transformation. So what happens here is that you can have a shape memory alloy which you deform at low temperature, and then the material, due to plastic deformation or permanent change of shape will assume a different structure. And then when you heat this material, it will actually regain its original shape. So this is a cycle. You deform, you cool the material, you deform it, and then by heating, you can, like magic, obtain the original shape. But there is another property called the two-way shape memory effect, which does not involve the application of any loading, which is basically obtained by cycling the temperature. When you increase the temperature and decrease the temperature, this strain is a measure of shape change actually, and this is the temperature. The material undergoes phase transformation, and between the two phases, you can actually, by cycling the temperature, cycle the shape and change the shape back and forth. There's another property which is related to the application of loading or providing the energy by means of loading the system, and this is called the super elasticity. And we like to show these things as material scientists on a stress strain diagram. Strain is the measure of shape change, and stress is the intensity of load that you apply to the material. As you see, you start at 0, and then you start loading this material, and then you obtain a constant state of stress. That is, the shape changes, but the amount of loading or the intensity of loading that you need to apply to the material to further change the shape does not increase. And then when you let the load go or unload it, even though a little bit of a different path, the material actually goes back to its original shape. So at the end, you have 0 load, 0 shape change. So this is called the super elasticity. Now, these values for the material that I'm going to talk about today can go up to 16%, which is quite a lot. So in irregular steel or titanium, both of which are quite strong materials, and they have a considerable amount of elasticity as compared to other structural materials. This is way too much of deformation that you can recover without any permanent damage or shape change to the material. Now, we have these 3 major properties, and let's talk about how they have been used in the medical field. Now, you see some examples here. These are some important and rather older examples. This is a glove utilized for physical therapy. In some cases, due to an accident or some other reason, a patient might lose the ability to use his or her muscles. And if the problem is with the hands, then what you do is during the healing, you have the patient wear this glove, and then this glove is covered with wires and tubes. So the wires are made of shape memory alloy, nickel titanium shape memory alloy, and you heat through electrical conductivity the wires up, and then you also cool them down. When you do that in a cyclic manner, what happens is that there's an open position and there's a closed position. So this is a good training for the patient, because the patient himself or herself cannot do this alone. So another example comes from the orthodontic field of medicine. When there's a broken jaw, then you need to kind of bring the 2 parts of the jaw together, and this requires surgery. However, back in the day, they used to use stainless steel, which is biocompatible. That's fine. But there's a problem with it, because when you bring the 2 parts together, the 2 broken parts, during healing, there's going to be tissue growth. And that tissue growth actually changes the shape of this staple, because it's like a regular paper staple, and then the 2 ends are going to start moving apart from each other because there's tissue growing in between. And this is not what we want, because for optimum tissue growth, the load applied onto these 2 parts of the jaw has to be constant and at a certain level. However, due to the pseudoelastic property of these materials, that is maintaining the constant level of stress or load, we can actually do this. And an ITI, that is nickel titanium alloys, have been used in this application quite successfully in 4 years. A similar application, maybe even more known to you guys, is the orthodontic arc wire application. These wires are used to change the positions of the teeth for, first of all, aesthetic purposes, but actually for functionality. And you can, over a certain period of time, move these teeth using the wires. So you basically attach brackets onto the teeth, and then the wires provide the level of stress that is necessary to break the tissue, the gum tissue, and then move the teeth together over a certain time, and thus promote new tissue growth. So the problem with the classical types of materials, such as stainless steel, is that, again, the same as in this case, and you need a constant level of force in here. When you use stainless steel to ensure a constant level of stress, what you do is you visit the dentist like every month, and it's a painful procedure. I myself have had that when I was a kid, I think for 3 years. So anyways, it's a painful procedure, and you have to visit the dentist every month. But if you use nickel titanium alloys here, due to the pseudo-elasticity property that we have just discussed, you can actually pay a visit to your dentist every 6 months, and still the treatment is going to be much better. Before I come to my case, let me give you examples from the other properties of the shape memory alloys. This is one of the most well-known applications. This is called the Simon filter. If following a series of heavy surgeries, there is a risk of the patient developing blood clots. This is inserted into aorta. But inserting something like this is a filter, as you see, requires like a massive surgery. But thanks to the shape memory alloys, you can just use a catheter and go through a minimally invasive surgery, and put it in its needle form, such that when the material inserted into the body at room temperature, that is about 22 degrees C, comes into equilibrium with the body temperature, which is about 37 degrees C, it assumes its high temperature shape, and then it opens up and it remains in place. And the same principle is what the famous self-expanding stents make use of. And also, this is another device called the atrial septal occlusion device, which is used to close the heart holes, especially in young patients, to avoid surgery. So these all make use of the so-called one-way shape memory effect, where the temperature promotes the shape change. Okay, so let me slowly get to what I have been doing about this. Now, our topic is the laparoscopic surgery, and in particular, the gastrointestinal laparoscopic surgery. So I'm sure everybody is kind of familiar with this technique, but laparoscopic surgery is a minimally invasive type of surgery where you enter the patient's body through very small incisions, and with the aid of camera and monitoring techniques, you can actually see what you're doing inside, and then this results in much shorter periods of healing and has certain advantages. However, it's not an easy procedure if you consider the surgeon, because for the surgeon, it's like hell, if I should say. This is a picture that, this is one of the many pictures that I made in the operation room. And these two hands belong to the general surgeon that I'm working with, Dr. Jarilla from American Hospital. And this is the hand of the assistant surgeon. So this technique is called the single port surgery. It might not look like this, but these things here, these are called the trocars. They go through the same hole, and that hole is the patient's belly button. So the reason for this type of surgery is the patient's demand, and this technique was, I wouldn't be wrong to say that it was born in California, where aesthetics is very, very important. And because if something goes through your belly button, the stitches are going to be there, and then at the end you don't have any scars. Seriously, this is the reason. And patients demanded more and more day by day. So you have to go through a small incision, which is about a few centimeters wide at the most, and then put all the trocars that are the ports that you put your tools, surgical tools through. and then you try to operate within such a small region. Well, this is what the current tools look like. They are all straight, actually. They have some flexibility at the end, but unfortunately, I don't have any pictures of these, because when you take these apart, I have done many times, these things contain like 50 parts or so, and these are really hard to maintain, and they are not really reliable, and each of them costs quite a lot. So anyways, the problem here is the maneuverability of these tools, which is not really good, because when these hands clash, there's a discussion, because the camera has to be taken out, cleaned, etc., and the surgeon loses his or her vision. So it actually costs the patient some time under anesthesia. And we would like to avoid this, and we said maybe we can make use of shape memory alloys to avoid this problem, and to improve the current state of the surgical tools. And actually, this is going in another direction. So that demand that comes from the state of California and has spread all over the world is growing quite quickly, such that people are now, and this is what the patients are interested in, they are interested in natural orifice transluminal endoscopic surgery, which means that you go into the abdominal region through the natural openings of human body, and at the end you don't have any scars after the operation. So this requires, however, like as you see from these schematics, equipment that should be really flexible. But believe it or not, many of the equipment used in this type of surgery today are the classical ones. So there is definitely a need for improvement here. And this is part of the reason we're using the shape memory alloys. Let me tell you about what we have done recently. We have filed a patent. We're still waiting for the answer for that, but the first stage was positive. For this equipment here, this is used in colon surgery and actually colon resection. When a patient has cancer, a colon cancer, you need to take out part of the colon. And in open surgery, this is quite an easy procedure. However, during part of the surgery, the surgeon has to make some decisions, and part of the decision is about cutting which part, and not cutting the important blood vessels. So the blood vessels, unfortunately, are buried in fat tissue. So this is a problem because you don't see where they are exactly, and if you cut them accidentally, it's going to be a problem. So there's this technique called Transillumination, such that it's similar to putting a light source right here, and then you can see some of the vessels. At least it's going to be visible, and it's the same logic. And you put a light source in open surgery right underneath the tissue, and you can see where the arteries are. But in minimally invasive surgery, since you're going through a single port, you don't have that chance. So what we do is we enter into the body using straight tools like these. So there is no chance you can do it with classical tools. But we have designed this new surgical equipment such that we make use of the pseudo-elastic property of the material. And when the tool enters the body, it's straight, because the ports that you have, if you recall from the previous image, they are straight ports. And when it goes into the body, now you can release this tube, which actually under no loading, under stress-free condition, has this like U-turn shape. And actually it has a cold light source. It has to be called light source like LED at the end, so that you can go right from behind the tissue and then illuminate it, and this is called Transillumination, and see where the vessels are. Actually, we tried this on pigs, and these images are from that surgery, and so far so good. It functions quite well, and it's a very simple design, a very simple idea, but we just make use of the shape memory property, the pseudo-elastic property of nickel titanium alloys that we utilize. Now I will show you another idea. No patents on this yet, but we're working on it. So this is more oriented towards the natural orifice transluminal endoscopic surgery. You need really flexible tools inside human body for that type of surgery. Now, this is a picture of a typical endoscope, and this goes through your stomach if you have a problem. But the disadvantage of this is that there are many tiny mechanisms within this tool, and they require maintenance. These are not reliable. However, our idea is much simpler than this. We thought that, okay, the entrance has to be straight into the body, but making use of the equilibrium and the solid-to-solid phase change promoted by temperature change, we can actually make tools that assume a predefined curved shape, which will be much more flexible to utilize in human body in the nodes type of operation. And when you cool them down using conduction, you can do that easily with the use of liquid nitrogen, cool it down by conduction, and you can take them out without any problems. So this is something that we have been working on. On the material side, this has many problems. There is the so-called training of the material, but this is also underway, and this is just another example of how we can make use of the shape memory alloys for the medical purposes. Well, my purpose here was to show you guys, an idea of how to use the so-called smart materials in medicine. They have been already around for about 30 years, but there's a lot of room for utility in new problems. So I think that's all I've got for today. If there's any questions, I would like to answer, but thank you for your attention.